Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about what a record and a report means, we've also discussed about the purpose of it, right? So in today's session, we are going to deal with the importance and principles of record. So here, in order to prevent the confusion between a record and report, we will be looking in detail about what a record is, what is the importance, what is the principles, and then you will be moving on to the importance and then the principles of a report. So as we've discussed, that record is a permanent written communication that will document all the information which is related to the client. In a record, you will be documenting not only just the information of the client, but also their disease condition, their, diagnosis, the treatment which has been provided to them, as well as, the various diagnostic tests, the management which you had performed for that particular client, right? So here there are also several importance of this record. The importance of record can be described under these 5 categories. The first one is the importance of record for the patient. The second is the importance of record for the doctor. The third is the importance of the record for the hospital. The fourth is the importance of this record for the public health. And the fifth is the importance of record in education and research. So this record not only has the information about the client, but it also has various importance, be it for the patient, be it for the doctor, be it for the hospital, or even for the public health, as well as it serves as an education and a research tool. So now let's look at each one of it in detail. The first one is the importance of record for the patient. Why do you think that this record is important for the patient? It is important because it can serve as a legal evidence, as we know that this record has the full information about the client, ranging from their name, their age, their sex, their occupational status, their education, to the medical diagnosis, and also to their history, to the physical examination which was performed, to the diagnostic test, their diagnostic test reports, as well as every treatment and procedure which was performed for them will be available in this record, right? So this can be served as a legal evidence if required. And the second one is that it avoids duplication of any treatment measures. So here, as I said, that we nurses must always document whatever procedure, whatever treatment that we have done for the client. So here, through this record, through this documentation which we have been doing, it will avoid any duplication of any treatment measures. Because here, as we all know, that we nurses have different shifts. For particular hours, we will be there. For the next hours, some other nurse will be there, right? There'll be change of shift. Now, because of this record, it will give the other nurse the idea of what are the various treatment that has already been done for that particular client, in order to prevent duplication of it, or also in order to prevent redoing of the same procedure again. And the next one is that it avoids duplication of any diagnostic and procedural measures. So here, for example, if you have performed any diagnostic test for the client, for example, if the physician has, ordered you to take the blood sample and send it to the lab. So if you have done so, you must record it. Why? Because the other nurse will be responsible for taking care of the client, will not be doing it again. And not only that, as I've said, that this record, has the whole information about the client. So even after you have sent the blood sample, after you've recorded, then when you get the lab reports, you must also attach it together, so that the physician as well as the other nurse will have an idea that this particular diagnostic test has been performed and the results is also present. This result will also assist in the continuity of the patient care. And also it helps in the health insurance of the patient. So this is why this record is important for the patient. Now moving on to the second one, that is the importance of this record for the doctors. Through this record, the doctor will be getting an idea about the quality of care which has been provided for the client. He or she will get an idea that whatever care has been provided, is it sufficient or not? Is it helping the client or not? Or is the client health status improving or not? So through this record, if the doctor feels that whatever care has been provided to the client is not sufficient enough, it's not helping them to promote their health enough, then he can make the necessary modification. However, if the doctor feels that whatever care has been provided to the client is efficient, then he can also enhance this continuity of care. The next importance is that this record also helps in the evaluation of the medical care which is given by the doctor. So here when a client comes to the hospital after he has been diagnosed with a certain disease condition, the doctors will then start with their medical care, right? So here just because, let's say that two clients are suffering from the same disease condition, we cannot expect that, we can do the same procedures for both of them, as we know that everybody is different, everybody is unique. So what treatment we are giving to one client may be helping them, whereas the same treatment which we are providing to the other client may not be helping them. So here we need to make sure that, we should always evaluate that whether whatever treatment we are providing or whatever care we are providing is helping the client or not. This record also protects the doctor from any legal activities. So these are the various importance of record for doctors. Now moving on to the next one, that is the importance of record for the hospital. Here the first one is that this record serves as a legal protection for the hospital. So as I've said that this record contains the whole information about the client, right? So being in the hospital, there are many cases that you may encounter. You may also encounter the medical legal cases. So here what happens is that in this record, every information about the client will be documented, ranging from when the client was admitted to the hospital, in which condition did he come to the hospital, what are the various treatment measures that has been provided, right? So here, if anything has occurred to that particular client in the hospital itself, then through the help of this record, we can also, serve it as a legal protection for the hospital. It also helps to evaluate the medical care by the doctors. So here through this record, we will be able to evaluate all the medical care that has been provided by that particular doctor to the client. Not only that, but it also helps to evaluate the performance of each and every individual doctor. So as I've said that, every patient will be having a record, right? So here, every doctor will be responsible for at least one or two of the patient, right? So here, through this record, we will be able to evaluate the performance of each and every individual doctor in that particular hospital. And the last importance is that this record also assists in planning and justification of the resources. Now moving on to the next one, that is the importance of record for public health. So here for the public health, this record will help in the early warning of the epidemic as well as the communicable diseases. Why? Because here this record contains all the information of each and every client, right? So here at that particular period of time when the people are admitted with a certain diseases which may be communicable and which is epidemic, we will be getting an idea of it, and this will help us in providing an early warning to the other people and also to encourage them to adopt various methods in order to prevent themselves from getting infected with these communicable diseases. So after we have detected this particular communicable disease, then the next thing what we can do is that through this record, it will be assisting us in planning the preventive as well as the social measures, which one can take in order to protect themselves from these diseases and also to promote their health. Not only this, but this record also provides information of the vital statistics such as the morbidity, the mortality rate, as well as the infant death rate. So these are the various importance of the record for the public health. Now moving on to the next one, that is the importance of record in education and research. These records are important because it forms a basis of the clinical research. It also aids in the formal education of the students and staff. Why? Because since this record contains all the information of the client, since this record will be containing all the history collection, the physical examination, the diagnostic test, the treatment, the procedures which has been performed for the client, then that is why this record can be served as an educational tool to the students and the staff, so that they will be able to learn and also get an idea about that particular disease condition and what are the things that can be done for that condition. And not only that, it also serves as a basis for conducting a research. So this is the importance of record in education as well as research. So these are the various purpose of records based on the 5 categories, that is the patient, the doctors, the hospital, for the public health, as well as in education and research. Now let's discuss about the importance of this record in general. The first one is that this record helps to supply data that is essential for the program planning and evaluation. Not only that, but it also provides the practitioner with the data which is required for the application of the professional services for the improvement of the family health. It also serves as a tool of communication between the healthcare team, between the families, and also the developmental personnel. So as I've said, that whatever has been done for the client or whatever will be done for the client will also be recorded, right? So here this record also serves as a communication tool with the other healthcare team professionals who is involved in providing care for the client, with the family members as well as with the other developmental personnel. An effective health record also shows the problem which is present in the family and the other factors that can also affect the health of an individual and of the family as a whole. It also helps in indicating the plans for future, and it also helps in the conducting of research in order to improve the quality of the nursing care. So these are the various importance of records in general. Now moving on to the next one, that is the principles of record. So we as nurses should develop our own method of expression whenever we are writing a record. We must also make sure that we write it clearly, appropriately, as well as adequately. And whatever we are writing, whatever we are documenting, we should make sure that it contains all the facts which is based on the observation, the conversation, as well as the actions. So in order for that to happen, what we should do is that we should select the relevant facts and we should make sure that we record it neatly, uniformly, as well as completely. So as I said, that this record can be served as a legal document, right? So we must make sure that we must handle it carefully and we must make sure that we keep it properly because we are accountable for it. And we nurses must also make sure that records must be written immediately after the interview. Why? Because so that we, document everything completely. Whatever information has been shared to us, we must document it correctly. So that is why it is necessary that we must record each and every information about the client, each and every information we have collected from them as soon as we have completed the interview. We must also make sure that all the record of the client must be kept confidentially. And not only that, we must also accurately, write the date, the time, and also put our signature after we have documented anything about the client. And we should also make sure that we should not include any abbreviation, any jargons, or even any meaningless phrases. So these are the various principles that we nurses must keep in mind whenever we are writing a record. So now here we've come to the end of this topic. So in today's session, we have discussed about the importance of records. We've also discussed about the principles of record writing. So I hope by now you have got a clear understanding of what this topic is about and what are the various things you need to keep in mind whenever you are writing a record or documenting any information about the client. So I'll be meeting you guys in another session where we will be discussing in detail about what report is. So until then, have a good day. Thank you.